Hi everyone, welcome back to our weekly Stats with Sara report. My name is Sara, epidemiologist here at the Jefferson County Health Department, and tonight we will be going over the week 35 data together. CDC's week 35 consists of data from Sunday, August 23rd to Saturday, August 29th. Let's start off with a quick recap of our week 35 numbers. We had a total of 383 confirmed and probable COVID-19 cases in Jefferson County. This brings our year-to-date total to 2,774. Please remember that the data reported in this video does not include data from the past few days. We report full CDC weeks at a time, so be sure to check the Facebook page and our website for the most recent numbers. As of week 35, we had 45 COVID-related deaths to report, which I will break down into further detail a little later on. The number of outbreaks in our long-term care facilities is 17 as of week 35. Outbreaks in those long-term care facilities are defined as one or more confirmed cases of COVID-19 in our residents or staff. During week 35, 56 cases of the 383 confirmed and probable cases were in long-term care facilities, meaning that 327 cases were in the general community. Let's begin, as always, by looking at the table showing the number of confirmed and probable cases by week. Each CDC week begins on a Sunday and ends on a Saturday. The week 35 data consists of everything reported to us beginning 8/23, which is the date that is listed on that second column, and it tracks everything through the end of the week, which was this past Saturday, 8/29. This table includes our lab confirmed and probable cases. The lab confirmed cases include those individuals who receive a positive result from a diagnostic test. And as a reminder, those probable cases include individuals who have met two very specific criteria. So one being that they were a direct contact of a positive case, meaning that they were within that 6-foot distance for 15 minutes or more of that positive case. And two, they have become symptomatic since having been in contact with that positive case. So the likelihood of that probable individual having COVID-19 is very high. They may just be waiting on a test result or have not yet been tested. This past week was slightly discouraging. As you can see at the bottom, our cases have increased. We've had the highest number of weekly cases that we've seen overall so far. In figure 1, we see the confirmed and probable cases by week. On the right-hand side there, you can see the weekly case count sitting at 383. We were really hoping to continue that downward trend that we had seen from the past couple weeks, but our numbers from this past week indicate that the community spread is still very high. It is so important to continue those mitigation strategies because we really don't want to see that number trend upward any more than it already has. We can practice some very easy habits to do our part in helping prevent that spread in the community, such as the physical distancing, staying 6 feet away from others in public, wearing our masks, and being more diligent with that hand hygiene. The next chart shows a breakdown of the daily case numbers and the 7-day rolling average of cases. The dotted line is that number of daily new cases, which, as you can see, it fluctuates from day to day. That solid blue line, which is the 7-day average, helps to smooth out those fluctuations in the data. This 7-day rolling average of cases is one of those indicators that is used for a color guidance chart for a county. Right now, our 7-day rolling average is right there around 54 cases per day, which keeps us in that orange status for this week. But we really need the help of everyone in our community to make sure that that number starts trending back downward. If it goes up, we could obviously be looking at a move to that red status, which is not something that anybody wants. So in addition to those easy mitigation strategies that I just mentioned, please remember that you can always help us here at the health department by answering the phone if we call to investigate and by cooperating with our contact tracers. Next, let's look at the overall age group data in figure 4. The 20 to 29 year age group has 517 cases so far, which is the most of all of our age groups. The 80+ age group still has the highest rate per 10,000. Once again, the 0 to 19-year age group data will be reviewed in further detail as we are finished reviewing our community data. In Figure 5, we will be looking at the fatalities and the fatality rate by age group. This past week, we sadly added 5 more fatalities to our count, bringing the total to 45. 11 of these individuals were in our general community, and 34 were residents of our long-term care facilities. Our cumulative fatality rate is 1.62 here in Jefferson County, which is still lower than both Missouri and the US. Missouri's fatality rate is 1.80%, and the United States has a rate of 3.07%. In Figure 7, we have the COVID-19 PCR test results by week, as well as a nice visual of that percent positive rate. This data only includes those lab confirmed cases, so the number will look a little different from our main weekly case count because it does not include those probables. That dark blue dashed line is our percent positive, and as you can see from week 34 to week 35, it is showing a bit of an increase. Let's break these numbers down in Table 3, where we can see the actual values of those positive and negative test numbers. In week 35, we had 351 lab-confirmed positive cases. That is 351 separate people who received a positive result from a diagnostic test. We never include duplicates in our count and have staff who work diligently to make sure that even if duplicate lab reports get sent to us, none of these are ever counted twice in our overall count. Our percent positive for week 35 is 13.4%. We do have a good number of negatives that have already been reported to us, which is that 2,267 number that you see at the bottom. However, it is still slightly below what we have been seeing for the past few weeks, which is anywhere from 2,500 to 3,000 negative tests. So I anticipate that our percent positive may change slightly as more reports are received, but that is definitely not to discount that percent positive that we are currently seeing. 351 positive tests is the highest number of positive tests that we have seen so far. Even if we do receive a good number of additional negative tests, that percent positive is probably not going to drop more than 1% or 2%. For those who aren't aware, we do rely on the state to process and report those negative test numbers to us, and there's often a 3 to 4 day delay. It is not uncommon to see that percent positive change for the previous week or two until all the lab reports come through to us. I always keep these numbers as updated as possible in order to be as accurate as possible. Small fluctuations in the data should be expected as more reports come in, and that percent positive usually levels out after about 2 weeks. Moving on to Table 4, the COVID-19 cases are divided up by race and rate per 10,000 residents. The Black population in our community currently has the highest rate per 10,000, and the white population in our community has the highest number of cases with 2,210. As a reminder, we do not include any missing or unknown race data when we are calculating these rates. For the zip code data this week, we can see the cumulative number of cases in each area shown in blue, as well as the active cases in each area shown in orange. The active cases are those new and recent cases that are currently under investigation and in the process of completing their isolation period. Our Arnold area, 63010, still has the highest number of cumulative cases as well as active cases in the community. A few other areas that have a high number of active cases at the moment, which are the orange bars that we are looking at in this case, are those areas of 63028, 63050, and 63052. As we look at the cases by zip code per 10,000 residents, things look much more even across all areas in this graph. The rate per 10,000 takes the population of each individual zip code into account. This helps to give a fairer comparison amongst some of those areas that may have a higher population or some that have smaller populations. As you can tell, many of our areas have a very similar rate per 10,000. Currently, the 63019 area, Crystal City, has the highest rate per 10,000. For hospitalization data this week, we are once again going to take a look at the data we received directly from our local hospital systems. We are currently receiving information from BJC and Mercy facilities and are actively working on receiving data from SSM. So what this means is that the hospital system reports that you find on our website, as well as the data I am about to present, is not complete. There are hospitalizations at those SSM facilities that we are aware of through our resident reported data that are not included in this report because we did not get the information directly from that hospital facility. This also means that there are deaths in which we are aware of that occurred in the hospitals but are not on this report as well. What is presented to you in this hospital report is meant to give you a snapshot of what is occurring in our community. It is not definitive data at this point, so it should not be used in any sort of context that would make the assumption that these are the only hospitalizations occurring and the only hospital deaths occurring in our community. We strive to report the most accurate data, and in a case like this, we will always be transparent as if there is any unknown or missing data. As of week 35, a total of 185 COVID-19 associated hospitalizations have been reported from the hospital systems for Jefferson County. 26 of these patients have been admitted to the ICU, and 10 positive COVID-19 cases required ventilators. In Figure 2, we see those hospitalizations by age group. The hospitalizations that are counted are going to include everything from an emergency room visit to those who are admitted as an inpatient. Each one of our age groups has experienced at least one hospitalization, the highest number being in that 50 to 59 year age group with 33 hospitalizations. As you can see, there really is not one particular age group that has an overwhelming majority of the hospitalizations. As we move along from week to week, we are seeing numerous admissions in each one of these age groups, 20 and up, but there has also been a few hospitalizations in that 0 to 19 year age group. So no one is really in the clear when it comes to this virus. It has the potential to be severe in all age groups. Next, we will take a look at the length of hospital stay. We had a cumulative total of 73 emergency room visits, which is a sign that those individuals have experienced symptoms that were severe enough for them to seek help. There are currently 18 individuals in Jefferson County who are still in the hospital at either BJC or Mercy facilities. And we are now seeing the largest number of our hospitalized residents staying in the hospital for around 1 to 2 days. But there's also a good amount of residents who have been staying for around 7 to 14 days as well. Our last report, once again, will be reviewing the current school-aged population data. As of week 35, there have been 321 total lab confirmed and probable cases in the 0 to 19 year age group for Jefferson County. In Figure 1, the number of confirmed and probable COVID-19 cases by week for the 0 to 19 year age group is shown. During week 35, there were 58 cases reported for the 0 to 19 year olds, which is the most we have seen for this age group so far. That weekly number is continuing to trend upward at this point. The next couple weeks will be very telling as far as the data goes now that schools are back in session. So this report that is specific to 0 to 19 year olds can be found on our website with a few additional graphs for those who are curious about what is happening in regards to those cases in our school-aged children. In Figure 2, we split up these cases by zip code. Just like our main weekly report for zip code cases, we have the cumulative number of cases in blue for each area and the number of active cases in orange for each area. 63010 Arnold, 63028 Festus, and 63052 Imperial all have over 10 active cases in the school-age children right now. In each report, I show a graph with the daily number of cases as well as the 7-day rolling average for each age-based grade level. For our last slide here today, I'd like to show the chart for our high school aged group, which is our 14 to 19-year-olds. Our other grade levels either decreased in cases or held steady from week 34 to week 35. However, the cases in our high school aged group continues to rise. And you can see this by that solid yellow line, which is that 7-day average. Because remember, our daily case numbers tend to fluctuate quite a bit, but that 7-day average helps to really show the trend of the data. That's all we have for today's stats. Thank you to everybody for tuning in and working hard to stop the spread of COVID-19 in our community. Stay safe and healthy and have a great night, everyone.